Malaria is a common tropical disease caused by a protozoa Plasmodium through the bite of female Anopheles mosquito. There are mainly 4 types of Plasmodium infection causing malaria as follow: 1 Plasmodium vivax, 2 Plasmodium falciparum, 3 Plasmodium malaria, 4 Plasmodium ovale. Life cycle. When an infected mosquito bite an individual, its saliva rich in parasite, sporozoites, is injected. The sporozoites enters his circulation and then the liver, pre-erythrocytic phase. It multiplies in the liver cells forming merozoites. After 5 to 9 days, the merozoites enter the red blood cells, erythrocytic phase, forming trophozoites, which subsequently mature to become schizonts. The schizonts are discharged into the bloodstream when the red cell degenerate. This results in an attack of malaria fever. The red cells are destroyed by the spleen, which enlarges, and some of schizonts continue to develop in the liver. Exo-erythrocytic phase, causing a relapse. Merozoites develop into male and female gametes. During the mosquito bite, these gametocytes are ingested. They fertilize in the mosquito's stomach and develop into sporozoites, which localize in the salivary gland of the mosquito. These sporozoites enter the human bloodstream on S subsequent mosquito bite and thus complete the cycle. Clinical features: 1 onset. The onset may be insidious with abdominal pain, nausea, dry cough, and malaise. Rarely, it may be acute and with fever and chills. 2. Fever with rigors. In the early stage, fever may be persistent for several days, but soon it develops into a synchronous periodicity. A classical attack of fever has a chills, rise in temperature to 40 to 45 degrees, headache, and myalgia. This is followed by several hours of profuse sweating and fall in temperature. In vivax and oval malaria, these paroxysms occur every 48 hours, whereas in malaria, it occurs 72 hours. 3 organomegaly liver is moderately enlarged and tender. Spleen is often palpable in acute attack. It is soft to firm and occasionally tender. 4 miscellaneous. Herpes lesions may be present around the mouth. Rarely jaundice may occur. Investigation: 1. Complete blood count for detection and identification of the malarial parasite. Blood smears must be repeated at interval of 6 to 12 hours on multiple occasions. Malarial parasite can also be demonstrated on bone marrow examination and by splenic puncture. Other investigations: serum electrolytes, bone, creatinine, blood sugar, blood culture, ECG, chest X-ray, serological test. Complication of Plasmodium infection: seizure, severe anemia, splenomegaly, hypoglycemia, lactic acidosis, late splenic rupture, nephrotic syndrome, convulsion, coma, immune complex glomerulonephritis. Differential diagnosis of severe malaria: 1. Meningitis, bacterial, viral, protozoal. 2. Viral encephalitis. 3. Enteric fever. 4. Relapsing fever. 5. Septicemia, puerperal sepsis. 6. Severe or fulminant hepatitis. 7. Trypanosomiasis. Treatment: supportive treatment, fluid deficit assessment and correction, fever control convulsion treatment. Specific treatment: 1. Chloroquine, susceptible for Plasmodium vivax, falciparum, oval, malariae. Chloroquine is given in the dose of 600 mg, followed by 300 mg at 6, 24, and 48 hours. This is useful to treat acute attack of all types of malaria. Pyrimethamine and sulfadoxime. A combination of pyrimethamine 25 mg and sulfadoxime 1500 mg helps to cure an acute attack of chloroquine-resistant malaria. Quinidine is preferable to quinine for parenteral use. It is given IV. The loading dose 10 mg kg dissolved in 300 ml normal saline infused over 1 to 2 hours. Quinine hydrochloride 600 mg tablet for 3 to 7 days is useful. This drug can be given intravenously if required for cerebral malaria. Other drugs: artemisinin and artemether, primaquine, mefloquine. Attention: First, talk to your doctor, then use any medicine. Treatment in pregnancy. Most of the antimalarial drugs are safe for use during pregnancy, and in children 10 mg per kilo of base as loading dose and 5 mg per kilo subsequently. Prophylaxis. One measures should be taken to prevent mosquito breeding like proper sewage drainage and preventing stagnation of water. Spreading oil over the water helps to kill the larva. Protective measures should be taken by persons staying in endemic areas. This includes sleeping under mosquito net and wearing protective clothing. I think you guys are understand everything. If you like my videos, please like and subscribe. Thank you.